this session, so if you don't consent to being recorded, please feel free to leave. But this is a good opportunity for us to refresh. Some new functionality went live this week, so we'll record this session. So my name is Robin Stewart. I'm with Accenture. We've been working closely with the Ministry of Health on the COVax vaccine management system. And this session is all about the clinical flow in COVax. So if you attended an earlier end-to-end meeting, we will go into a bit more detail about the specific clinical flow, the process of checking in a client, administering the dose, and checking them out. So I will show my screen of COVax. Share this one. Good. So you should be able to see COVax. I'm currently logged in as a system administrator, so I can see all of these tabs along the top of the screen. So you'll see different tabs depending on your role. So if you're a vaccine administrator, you will see the client search, the clients, and the dashboards tab. If you're an inventory administrator, you will see these three tabs plus shipment and inventory. And if you are a site super user, you will see all of these tabs except for dashboards. Instead, you'll see reports, providers, and mass data loads. So it's important to note that before you can start a mass vaccination clinic, that 4 things need to be input into COVax before you can start. So the first is, of course, you need the ministry to set up all of your users. So once you have your users set up, the next step is that your site super user, they will do a mass data load, which is intended to upload all of your client lists. Then they will make sure your site supervisor will make sure to share any providers. Those are people who will be administering the vaccine to the Ministry of Health, and the ministry will upload those providers. And then the inventory administrator, so the 4th thing, needs to input inventory, which is made up of shipments and inventory. So once all of those things have been added into COVax, you can start your mass vaccination clinic. And I like to call this client search tab your home page or your home tab for the vaccine administrator. So this client search is where it all begins, where you, find your clients, figure out if they're registered on the list, and of course, open up their client profile. So in this little session, we will talk about search, the client profile in more detail, and the clinical flow. So if you've participated in the end-to-end, you will have heard me say that this first search bar, what we call the global search bar, is the most forgiving search bar. It is one that you can put, for example, multiple words in, you can put numbers, and you can put partial words. So if I'm looking up, for example, Frank Chen, I can put in his name. I can even put in his health card number. For example, click search, and then I will find my client, Frank Chen. So I could do the same thing in first name, last name, and health card parameters. But for example, if Frank Chen didn't have his health card in his profile and I put it in here, then he would not return as a result. If I, for example, misspelled Frank's name with an A and called him Frank Chan, and I put Chan here, again, it won't produce a result. Excuse me. So it's important that when you use these 13 parameters here, that you know that you're putting in the information fully and accurately. Excuse me. So I'll give you an example. I can put in, for example, Frank like this. Search. No, this time it didn't like that. Clear search. I will try that again. Frank, and I will just put like this, and it will find his name, for example. So it pulls up for me, Frank Chen. Excuse me. So we do recommend that when you're using the search, you use the global search as much as possible. You may use these other parameters. And if you have difficulty searching somebody, we do recommend you try by their health card number. It may be that in the bulk client load, their health card number wasn't uploaded, but it will save you time if, for example, this same health card number was uploaded to somebody with a different name. So maybe, for example, Frank Chen has another legal or given name that he used that got into the system. Then by searching his health card number, you will find him. If we, for example, pick just Frank, which I will do just for the sake of this, and we get a number of different records, like 7, you'll notice here that to find the correct Frank, so if this was a name like John Smith or something very popular, you want to look at the health card, the date of birth, and or the mailing address, sometimes the phone numbers, to find the correct Frank that you're looking for. So right now, what I'm going to show you is creating a new client. So most of your clients, 99.9% of them, should be bulk uploaded ahead of time for you. But if for some reason you need to create a new client, you can do it using this button. So I'll create a new client. So when might I create a new client? So in some situations, we have what we call walk-ins. So where somebody has arrived for the vaccine and maybe they were not on the list, or they were supposed to be on the list, but they got missed, we might be able to add them. Of course, that is subject to 3 things. First of all, the availability of extra vaccine for them on the day. The second, of course, is that they meet the eligibility criteria to be vaccinated. And thirdly, that in some cases, we need a level of authorization to add them to the list. So that might be your site lead, or it might be a head nurse or something like that, who would make sure that this person should be vaccinated. You may also find that at the end of the clinic, if there were multiple extra doses extracted, you might find somebody else eligible and add them onto the list. So that might also be a case. So I'm going to create a new profile. I'm going to call her Ms. Fairy Godmother, for example. And I will add in her identity. So we have a strong preference, of course, that we input an OHIP card. It does need to be the 10 digits, so not, I have a bit of a formula for this, because you have to come up with a unique number. So I think I'm on this number now. So in the real live environment, you can't just put in a random number. It does compare it against databases. But here in the training environment, as long as it's 10-digit number, no verification code. So note that if somebody is trying to bulk upload the client list with a verification code, all of those clients will be rejected because we're only using the first 10 digits. So alternate ID, the ministry has decided that if a person does not have a health card number or does not have the health card number with them, you can accept alternate ID. So one of the more common, for example, if you're working in Ottawa and you have healthcare workers who are residents of Quebec, for example, or caregivers, you might have an out-of-province health card number. You might write QC and then the number of their health card here. If it's their driver's license, you write the driver's license number there. The employee ID is intended only for healthcare workers and only when you input the organization that the healthcare worker works at. So that's alternate ID. We need to set a birth date. It is one of the mandatory fields. So to do this, you'll want to make sure to go to the year first, so you don't end up having to scroll through all the months over and over. So I'm going to go back. I'm going to make this person a healthcare worker, because in the last end-to-end, I demonstrated long-term care resident. So we're going to make this person so we'll make her female. We'll indicate her service delivery location. So we're going to have her at Applefest Estate, which is long-term care home. And she's going to be a long-term care, for example, healthcare worker. So in the reason for vaccination, we have a number of priority groups that are currently in this phase. So we can select from those. And when we put a healthcare worker, or we put a resident or anything like that, we do want to put their organization so that we can select the correct. So we could create a report if we needed to that pulls all of the number or name of people who have been immunized at that home or who are employed by a certain organization. So in this case, she's a healthcare worker at Applefest Estate, and her vaccination is happening at the home. Here in the profile, there's a spot for public health unit, so we do not need to set that here. In the training environment, it will remain blank, but in the real live environment, it will be set by the postal code in their address. So we will want to make sure to scroll down and input an address for her. So I'm going to put an address of, for example, 1 Market Street in Toronto. And we will autofill. So Google autofills this address for us. And so in the real live environment, based on this postal code, the public health unit will be set. It's not set up to do that here in the training environment. So the next thing we'll need to fill in is the contact information. So if the person is a long-term care retirement home resident and they have a proxy, you will fill in their proxy's name. You can select a relationship to the client, such as substitute decision maker or spouse or something like that. And you'll put the proxy's phone number here if they have a proxy. If they don't have a proxy, so like fairy godmother, we'll put in her phone or mobile phone. So I might put, for example, her mobile phone, and I can put in her email address. Something like this. And that will allow us to send her a proof of vaccination receipt by email, of course, follow up a communication potentially by email, as well as if she consents to research communication, she can also receive that by email if she has an email address here. Now, at some of the homes, they have been using this email address field to put in an administrative email address for the home when they are for residents who don't have an email address. Then the home can receive on their behalf their emailed proof of vaccination receipt. They can then also decide to print additional proof of vaccination receipts, email them to their proxy or to another medical professional if required, etc. So you may want to consider putting that measure in place if that would be helpful in your context. And then finally, if we scroll past address, there's this section on client consent information. So for a client who walks in like this, it will be blank. The client consent information is intended to be here so it can be bulk uploaded from the client list. So I'm going to just show you the client list here. So this client list is what you use to bulk upload. And you can see in the client list, there are some fields here. Oops. Here for capturing consent. So this is when, in, for example, the context of a long-term care home or retirement home, if a consent form was filled out ahead of time, you can input the consents that were provided and bulk upload them. Then they will turn up here as checked boxes, and that can help facilitate the checking in process. Otherwise, if my client is consenting on their own and they walked into this clinic, I will just save because we will not need to take this prior consent. So now we have Mrs. Fairy Godmother set up. So of course, if we had not just created her, we will want to do a review of her profile for completeness. So we'd scroll down. Otherwise, since we've just created this profile, we can go ahead and check her in. So before we do check her in, I would like to point out the status bar. So in each client profile, there is a status bar, and the status will go from new. We will skip first dose scheduled because right now COVax does not have scheduling capability. It is on its way, and so do anticipate in the future using this scheduled status and some new scheduling functionality. But for now, we'll go from new to first dose checked in, first dose administered, and first dose checked out. So these three statuses correspond with these three action buttons at the top of the profile. So if you were set up in an actual clinic or hospital, for example, they'd also correspond with different stations you might have set up. In a long-term care or retirement home, you're more likely, of course, to have one person who's checking them in and administering the vaccine. They may also check them out, or they might have another person monitoring AFI and checking clients out after they've waited their 15 minutes. So I'm going to proceed to check Fairy Godmother in by clicking check in. And here you'll see the check-in screen, which I'll just scroll through quickly. It's this screen. The first section is an acknowledgement of the collection, use, and disclosure of personal health information. So if the person is able to consent and you don't already have a consent form for them, then you'll want to read out loud this statement and request their consent to capture data in COVax. So once they've consented to capturing data in COVax, you can click this consent to data collection button or checkbox. There is this other field here, COVID-19 assessment complete. It's, it maybe could have been at the top, but essentially by this time you want to make sure that the client has undergone some type of screening for COVID-19 pre-assessment. So whether that was setting up a station before they entered the clinic, or making sure, of course, in terms of residents, that you find out if anybody has been in close contact, et cetera, or is at risk of COVID, so that we're not at risk of spreading any COVID through the mass vaccination clinic. So you'll check this box, you'll check the consent to data collection. Now, what happens if they don't consent to data collection? So of course, we will not check this box. We would leave this screen by clicking the X, and we would use a paper data entry form. So the ministry has created this form that's called the COVID-19 vaccine data entry form. This one is for Moderna. There's another one for Pfizer. The only difference on the form is that one, they both have product name, and secondly, that they both have the dose input already. So you can use this form to collect the information of any of the clients receiving the vaccine who do not consent to digital data capture. Now, the ministry has decided that they do want to collect data for all clients, so they must accept the use of this paper form, and this form will not be input into COVax. So if they do not consent to data collection, down here in the consent portion, of course, we would leave this checkbox blank, consent to data collection. We would want to have consent, of course, to receive the vaccine, so this one should be checked. But there's no need to get consent for email communication or COVID vaccine-related research communication. So in that case, once this form is filled in, this would not be entered into COVax because there's no consent data collection. Now, there are two other reasons you might use this form other than non-consenting to data. And in both of those cases, you should be able to enter the data into COVax through a data entry process. And those two reasons are, first of all, if COVax was ever to go down and we weren't able to access it to input the data during the clinic, then you would need to have these paper forms on site. Of course, you would take from clients consent to data collection, and then these should be manually input into COVax within 72 hours of the clinic. The other reason you might still use this form is if you are sending a vaccination team out to a rural or remote location, or using a vaccination team that is temporary. So they might not be registered as users of COVax, and so they will use the paper form. And then again, it should have consent to data collection checked for all the clients that consent, and then this data can be input into COVax. So you'll see that the client information pertains to the information in the profile, the proxy. The consent comes from the check-in screens, and the administered dose information comes from the dose administration screens. And there is a handwritten receipt that you can separate from this form and provide to the client. So that's the paper form. And again, if you have any questions, don't hesitate to put your questions into the chat, and my colleague Ellen will be happy to answer them for you. I'm going to go back into COVax. We're going to receive consent for data collection. And we're going to ask the client about, sorry, you can read this statement, about consent to receiving follow-up communications by email or text and SMS. So please note that in order to receive a printed, an emailed proof of vaccination receipt, they will need to check this box to consent to email communication. And then there's consent to being contacted about research studies. So again, they can read out this sentence and request consent. So if this client consents to receiving communications by email, we do that. You can see the reason for immunization is there. And if we did change it here, we would change it on the profile. And then it registers who was the person who checked them in. So in this case, myself. So I'll click next. And now the client is checked in. So you'll see their status move from new to first dose checked in. And now we can proceed to administer the dose. So I use the administer dose button. And here I will select the vaccine. So if I click on this for myself, because I've used the system many times, it will ask me, or it'll show me recent inventory. So in my location, you'll see all of this is at Applefest Estate. My location, there are many. Now, this is unlikely to be the case at a long-term care home outside of the training environment. In real life, at a long-term care home, you'll more likely only have one record. But it is important still that the vaccine administrators, they look at the labeling on their vaccine and they confirm that it matches, for example, the lot number and expiration date, and then they can select this inventory. If you are going in here your first time, you will have no recent, so you'll have to search, for example, Moderna, and it will give you all the Moderna options, or Pfizer, and it will give you the Pfizer options. So I'm going to click Next. Then you will see the Moderna pre-screening assessment. So this pre-screening assessment is the same for Moderna and Pfizer. It's a questionnaire related to the contraindications that can be associated with the vaccine. So if the person is able to consent, like fairy godmother, we'll have a conversation with her about this, ask her these questions. If, for example, she checks any of these boxes because she has a contraindication, we will check them. If the client is not consenting and you have a consent form, of course, you would check any boxes on the consent form. And then at the end, you would click pre-screening assessment complete. So please note that you can click any or all of these and the system will not stop you from proceeding. So the system is not a medical professional and it cannot determine whether it's safe or not to proceed with the vaccine. So it's important to refer to the manufacturer guidance and use your clinical discretion to determine whether it's safe to proceed with the vaccine. But if, for example, this client had maybe some autoimmune problems, immune system issues, and I wasn't sure that it was safe to continue, then what I might do is I would leave this screen. I'd go back to their profile and I'll select a reason that the vaccine was not administered. And so there are 3 reasons it might not be administered. So one is that the immunization is contraindicated. So if in our conversation we decide that, or I as a nurse, for example, decide that it's not safe to proceed because of a contraindication, we will not expect the client to come back for a vaccination, for example. We can select immunization is contraindicated. If, however, I am unsure about the safety of proceeding with the vaccine, and I want to recommend that this individual talk to their primary care provider, then I could select practitioner decision to temporarily defer immunization. So I might do this and then expect that the client might come back for their vaccination if their doctor determines it is better to proceed with the vaccination. And then the last option here is that the practitioner or myself, I recommend the immunization, but the patient does not consent to the immunization, in which case we would select this option. So if clients are not vaccinated, they do stay in the checked-in status, and the administrators can generate a list to see people who have not received the vaccine for a reason, for example. So I'm not going to indicate a reason. We're going to proceed to administer the dose for fairy godmother. Select Moderna. We'll select VB01 lot number. Next, go through the pre-screening and indicate that we're complete with no contraindications. Click Next. I obtain verbal consent for service, or if you have a consent form, of course it's implied on there. For Moderna, there is no diluent, but for Pfizer, there is. So again, it's important if you're using Pfizer to click on here, search diluent, and then you will pick the diluent, also using the lot number and expiration date. The route is preset intramuscular. You would select the anatomical site, usually left or right deltoid. The time and date will be automatically set for the time that I opened this page. So that was about 1 minute ago. If I am data entering, for example, from this paper form, and I need to backdate this, I can go in and select a day before. And for example, I can set the time to the actual time of the vaccine. So let's say it was 10:35 a.m. I can set it just like that. And then I can select a provider. So it provides me with recent providers I've selected, myself and my colleague Nick. If I'm data entering and I need to find a provider, I will, for example, search their name. I can click down here to search, and then I will see my provider, Nick Verlaine, and I can click his number and he will be added to the record. And then I can click next. So you'll notice that this summary information is going to be the same information that goes onto the printed proof of vaccination receipt. You'll notice that right now the vaccination receipt does not have the name of the provider on it, and that is for privacy reasons, but it does have the provider number so that it can be traced to the provider. So if there was an error here, I could click previous and edit it. Otherwise, I can click next, and we'll complete the dose administration by clicking finish. And now you can see that the first dose has been administered and the status changes to that. And you will notice that this record, dose administration record, was created. So you'll see that if I needed to, I can click into the dose administration. And I could also here, if I needed to, edit certain information like the provider or the time and date given, or even perhaps the lot number, the vaccine inventory if I picked the wrong lot number. So people shouldn't have to do that very often, but if necessary, of course you can. To go back to their profile, you would click on their name. Good. So now at this point, the client needs to wait their 15 minutes, be observed for any APHI, and then they can be checked out. So as I mentioned, you may be set up in a way that the person who vaccinated them will leave and go on to vaccinate other people. They may return after a point and check clients out, or you might have another person who is there to observe APHI and check clients out. So if I was trying to find a client to check out, I would go to the Clients tab, and I would change my list view to dose administered clients. And now I'll be able to see there are actually 2 fairy godmothers in here, but this is the one that I created just now. So I'll click her. And then we can proceed to check her out using the checkout button. So there are 2 rather simple questions on the checkout screen. So currently we do not have APHI or adverse events following immunization reporting capability in COVax. So we will be using the current status quo process of reporting APHI to public health. And we do that using the APHI reporting forms. So you'll want to make sure you have some of those printed or digitally on site so that they can be submitted. And here it says, select only if adverse events following immunization were experienced during the immunization event. Documentation to be completed on the adverse events following immunization form. So this essentially means that if there was an APHI, it should be documented on the APHI reporting form. And if there was a form for it, you check the box for it. If there is no form for it and there's no APHI, you will leave this this box empty. So it's saying there's no APHI. If there is an APHI after 15 minutes or once the client has left the clinic, you will not have to update any information in COVax. You'll want to make sure that the client leaves or the home has with them the correct discharge paperwork and instructions about how to communicate any APHI to public health if necessary. And then finally, if somebody has an adverse event following immunization or an APHI, and they do not leave the clinic on their own accord, so maybe they go by ambulance or something like that because of an anaphylactic reaction, then we would still like you to make sure to check the client out and, of course, to check this box for APHI. Next is the email receipt to patient question. And here we would click this box if we do want to email the client an emailed proof of vaccination receipt. You will only see this box if they have both provided an email address and provided consent to email communication. Otherwise, you won't even see this as an option. This here on the screen, click here to view receipt, is a very tempting hyperlink that I highly recommend you do not use. I will show you it. It does take you down a little bit of a rabbit hole. It opens a new tab of Salesforce that looks quite like the original one. This view of the receipt is a bit different. You can still download and print the receipt, but what you might accidentally do is then proceed to use COVax from this screen. So then I will go to my client search, I'll find my next client, or I'll go to the client's tab and try and find whose dose administered so that I can check them out. And if I did that, I would still see Fairy Godmother in here because if I go back here, I haven't actually finished checking her out. So I highly recommend that you don't take this step, that you bypass this click here to view receipt button and you go straight to next. You watch that they are officially checked out and their status changes to checked out. And you see a file created here. So this file is their proof of vaccination receipt, which you will see now. You can see if you scroll down a blank line for you to manually write in the date and time of their second dose appointment. You can then download the receipt here. And you will open a new tab and you can print the proof of vaccination receipt for them. So then you can close this tab and X out of this. And now Fairy Godmother has been checked out. So she will receive her proof of vaccination receipt. I'm going to simply do a dose administration change. I'm going to backdate this dose administration to show you something during the second dose appointment. So I'm going to change this date. So today's date is this. We backdated it by 1 day for her vaccine, but I'm going to backdate this by 28 days and save, because of course for Moderna, 28 days is when you want to be vaccinated. So when I do this just for the sake of this demonstration, I'm going to go back to her profile. And now we can proceed to check her in for her second dose. So again, we will bypass second dose scheduled and go directly to second dose checked in, second dose administered, and second dose checked out. I want to show you just a couple changes on the screens there for the second dose. So I'm going to click check in. And here you will see the previous vaccine that she received. So she received Moderna. She received it on January 4th, which was 28 days ago. So now I can indicate that she is eligible for dose 2. This is a date counter, and this is why I backdated the dates, because otherwise, of course, it would show me 0 days since vaccination, because we vaccinated her today. But I've backdated this so that you could see that this does count up. In terms of eligibility, the system doesn't determine their eligibility, and it will not prevent you from vaccinating somebody earlier or later than the vaccine, the beneficial window. So it will be important to refer to manufacturer guidance and use your discretion on the eligibility for the dose. So since she's coming at 28 days, we're going to indicate that she's eligible, and we can click next. So notice that the check-in screen is the same, and it is not filled in, so it is blank. So you will have to, again, make sure that the COVID-19 pre-screening has been done. You'll obtain consent for data collection. You'll obtain consent for email or text communication for follow-up. In this case, I'm going to leave email blank so that you see the difference on the checkout screen. And you obtain consent about research communications. Now I'm going to click next. And now she's checked in for a second dose, so her status changes. I can go to administer the dose. And now here it also tells me what vaccine she had last time, so the Moderna vaccine, the anatomical site, and the days since the last dose. So I can select now the vaccine. So I'll use Moderna again, of course, and I will use this version. So if my label indicates I have KY123 with this expiration date, then I can proceed. I get the pre-screening assessment. So again, please note, this is not filled in again. So you will need to go through the questions again and make sure that you check any potential contraindications and click that the pre-screening assessment is complete. Click next. Obtain consent for service. No diluent for Moderna. Route doesn't change. Select the anatomical site, so we'll go left deltoid again. The date and time are set at the time I open the page, and now I need to choose a vaccine administrator or provider. So click next. You'll see again the dose information here that will go on the proof of vaccination receipt. You can click next, and now that's complete. You'll see that once the status has changed, there's now a new dose administration record. So if for any reason I needed to edit that, I can click in here on DA 10639. Otherwise, the client, of course, will wait their 15 minutes for to be observed for AFI. Then we can proceed to check them out using the checkout button. So you'll see the same AFI question. So select this only if they had experienced AFI while on site. So if they did, we'll click. If not, we leave it. And you'll see that there's no question related to emailing the proof of vaccination to the patient. So you can't do that at this point. So that's why you want to make sure that the consent is granted or used and there's an email address on their profile. So now I can click next. And now the client is successfully checked out of their second dose. You can now see that there are 2 files here. The topmost one will be the newest. And you can print their proof of vaccination receipt. And of course, now there's no line at the bottom indicating that you have to write in a second or third dose appointment. So that is the end of the clinical flow, and I think everything you need to know about documenting the vaccine administration in COVax. I'm happy to open it up if you have any questions. Otherwise, we do have office hours daily from 11 to 12. We have a job aid that goes into great detail on this, or at least a refresher on this. And there are also pre-recorded sessions. This session has been recorded and will be uploaded onto the ministry site. So your site lead can pull it down if you would like a refresher or you want to share it with any of your colleagues. So, are there any questions?
No active questions in the chat, Robin. Just an FYI to everybody, I did pop a feedback survey in the chat window. So if you have a couple minutes and you'd like to provide us with any feedback on this training, feel free to fill that out.
Thanks, Ellen. Great. Well, if nobody has any questions, then we're happy to let you go, and feel free again, check out the job aid, the pre-recorded videos, and drop into office hours if needed. There's also a help desk. I'm happy to maybe get Ellen to pop in the chat the help desk contact information, just in case you run into any issues and you need to get that. The help desk information is also on all the training materials. So thanks, everybody. Have a good afternoon and good luck in your vaccination clinics.